Hello, I'm Monica Kuzminskaite. I'm a health and nutrition psychologist, and this is my podcast that I call Spoonful of Reason. And this week we discuss self care. In the healthcare literature, self care is identified as a specific type of behavior necessary for healing and disease prevention. A doctor will not always be standing next to you with a stethoscope around their neck, glasses on the nose, and prescription in their hand and instructions on their lips. Your mother will not always tell you to eat your vegetables or brush your teeth. Sooner or later, the moment will come when we as adults will have to take care of our own health. Whether we will do so successfully depends on several things on knowledge, experience, skills, self compassion, and self efficacy. Today, in the general racket of information, advertising, and influence, reliable knowledge is becoming increasingly rare. To understand whether knowledge can be relied upon, it is essential to develop our own critical thinking. Otherwise, we will be pulled in different directions by emotionally driven messages and will be constantly anxious, unable to rely on anything solid. For example, someone who does not know that excess sugar is harmful may diligently avoid fats at all costs and replace them with sugar, thereby doing nothing good for their health. A person who gets their knowledge of health eating from their neighbor, advertisements, or influencers will not have a solid and correct foundation for a healthy life, unless, of course, they happen to succeed by accident. In addition to knowledge, actions that shape experience are also necessary. A person who has only ever boiled an egg in their life will not suddenly start making salads, stews, or soups because they have neither the relevant experience nor the skills. So, again, they will not be taking care of themselves. The authors of recent studies agree that the most important elements of psychological self care are self compassion and mindfulness. Self compassion does not mean that we allow ourselves everything and live according to the principles of pleasure. Self compassion means recognizing that mistakes have been and will be made, that mistakes are necessary for improvement, that the carrot is better than the stick, specifically visualizing future goals in positive light and encouraging and praising ourselves for the results we have achieved, turning failures into lessons. Mindfulness is the ability to focus on essential aspects of actions, thoughts, and emotions and shift them away from unproductive ones, such as worrying about things that cannot be changed. Mindfulness is the foundation of all meditation practices and is a learned, cultivated skill. Research has shown that digital tools are effective, so don't be put off by the idea that counseling or classes are too expensive or inconvenient. Taking care of yourself in terms of eating is more focused on controlling your behavior and self efficacy. Measures that help you assess and manage a diet that is right for you are also important here. Self efficacy is effectively developed through training in setting goals, prioritizing skills, and mastery in a broader sense, the ability to use and accept professional help in person or remotely, and the ability to seek and find appropriate methods of behavior control. Some people are better suited to preparing food for the week, others to subscribing to healthy food, and still others to keeping a diary. There are many ways, and not every way is suitable for every person. That's why it is important to accept mistakes in the proper way, not as proof that the easy way doesn't work, but as valuable information in finding and refining the most suitable method for you personally. Taking care of yourself in terms of eating involves more than just monitoring your diet. It includes all the essential habits of a healthy lifestyle: exercise, sleep and rest, washing, solving problems rather than forgetting about them directly or with help of psychoactive substances, paying attention to the positive things in life, not allowing others to humiliate and belittle you, and, in words of Confucius, not doing to others what you would not want them to do to you. No matter how you look at this, it is the responsibility of the individual, not mom and dad, even if you're 40 and still want to complain that no one taught you how to take care of yourself properly. Not the health care system, not your employer, and not your aunt or social media. Taking care of yourself is not and cannot be pampering yourself just for the sake of pleasure. Taking care of yourself always strengthens the body, builds strength, supports natural body processes, and essentially never has pleasure as its primary goal. Pleasure can be a natural consequence. Just thinking about long night's sleep makes my knees weak, but it's never the goal. Getting enough sleep is important because a lack of sleep disrupts many processes in your body: attention, memory, executive functions, perception, metabolism, and poor sleep quality also increases the likelihood of gaining weight. I could go on and on. Doing what is healthy for the body is not always pleasant in here and now. But just because I want to do something is not really a reason to act a certain way. Or let's put it this way: I want to act in a way that I will not regret, if regretting at all. Take care of yourself because no one else will. Combine behavioral control measures such as goals, reminders, plans, and diaries with psychological measures such as cultivating mindfulness and self compassion. That's all for this week. I'm Monica Kuzminskaite. I'm health and nutrition psychologist. I write, I give lectures, and I post on social media. I also give psychological counseling sessions. You will find the link for registering for a session under each post, and you will find my posts on social media. Uh, Search for keyword Spoonful of Reason or just for my name. If you have any questions or comments, please drop me a message on social media. Otherwise, wishing you peace and serenity.